Assalamu alaikum, everybody. My name is Dr. Reem Shafi. I am currently residing in Chicago, Illinois. I welcome you to our first conference on future of dentistry. Again, this is a virtual conference. I think that is where we are heading, unfortunately, with COVID. But I think this is a great way for all of us to at least still engage and still retain some sense of normal, I would say. I have had the privilege of being able to speak to you guys. So, a little bit about myself today. I graduated from Temple University, the School of Dentistry, in 1998, then moved to Illinois, and in Illinois ended up opening certain locations, multi-locations. I'm also in California. I sit at the board of Temple University, which is the board of visitors. I also sit at the board of Temple Dental, and I am the Alumni Association president. And I also go to Temple from time to time to lecture on various practice management courses. So today I was asked to speak a little bit about practice management. I will try not to bore a lot, but I promise to stay within the time allotted to me. It's an interesting topic. So, this is a topic that is very close to my heart. We do this day in and day out. We are running several practices. We are engaging in operations. We are engaging in marketing. We are planning. We are focusing on all these things. So a little bit about the topics that we're going to be talking about today is going to be dental operations, marketing, treatment planning, again, increasing revenues and branding. With all of us being hit with COVID, if anything, now is the time for us to really, really focus on what is it that we are trying to achieve from our dental practices, which interestingly, the first thing that comes to the topic that I would like to talk about is branding. Obviously I've got branding at the last point, but branding is something that I'm going to be touching throughout our slideshow today. Branding is something where you as a clinician recognizes who you are as a brand. Are you a brand that is going to be the most elite brand, or is it a brand that you are going to serve the masses? And, again, brand has nothing to do with quality. Brand has a lot to do with who your patients are, which population are you actually going to be working with. So branding is important. As part of branding, your staff should be aware of who you are. Your staff should be aware of what the brand is. What is the dental brand that is attractive? What is it? What kind of customers are you bringing in? What kind of patients are you bringing in? So as we go into operations, which is going to be the key part of our topic today, I'm going to be talking to you guys about who are the key people in operations. Honestly, the key part of operations comes in staffing. I've learned one thing, that your staff has to be aware of, again, comes down to brand, comes down to who you are. What are you serving the population that you are serving? And really, at this point, these guys are your people. So communication with your staff is going to be vital. The other part that is extremely vital is your staff should know who you are, what motivates you, what makes you the clinician that you are, and why your dental practice. Like, what is it? We all went to dental school, we all love dentistry, but a part of you is what makes you apart from the other doctor who's down the street. So what makes your dental practice different from the dental practice that is down the street, right? Now, in that part, the most important positions that you're looking in a dental practice is going to be, your financial coordinator, your patient coordinator, your treatment plan coordinator, right? Now, again, if this is not a large practice, the financial coordinator, the treatment plan coordinator, the patient coordinator is literally one person. That one person is literally running your dental practice. So, what kind of qualities are you looking at someone who is a financial coordinator or your treatment plan coordinator or your manager? It's someone who knows who you are, right? Who knows what you stand for, which is the most important part, the service and patient care, right? So patient care is going to be the first and foremost when it comes down to running a dental practice. And the other part that is going to be important is compassion, really. This person needs to understand that we are talking to patients, we are bringing in patients, okay? She or he is the first voice that is going to be heard by the patient, or the first face that is going to be seen by the patient as they walk into the practice. So, what are the important features of that position? The person has to be friendly. The person has to be knowledgeable. The person needs to know what you stand for, and the person needs to know that this is what will make or may or break my dental practice. So, as far as the daily day-to-day running of dental offices, I typically like to start my day with something called a morning huddle. You don't necessarily have to have a morning huddle. You could have an afternoon huddle. You can have an evening huddle. In my practices, this is how I feel. I get connected with my staff. I get connected with my assistants. I get connected with my patient care coordinator. And I start my day where I am looking at my schedule, obviously. I am looking at issues with the schedule. I am looking at my production that is scheduled for the day. I am looking at collections that came in yesterday. I'm looking at issues that happened yesterday, right? So, key features in determining the health of your practice are, it's like your practice, or you should consider your practice software like a car dashboard. So the car dashboard has the fuel gauge, the oil gauge, the thermometer gauge. So again, what comes down to is your practices has these gauges, which are software, which are information that you can pull from your software, is production for the month, collections for the month, new patients that are coming in for the month, and your recare system. So now, as we relate this to the morning huddle, you realize that your team actually needs to know what is going on a daily basis, right? If your team is not aware of these things, how is your team going to know that there is a problem with this dental practice, right? So, what I do is I start my day with a morning huddle. I am looking at yesterday's schedule, and I'm looking at today's schedule, and I'm also looking at tomorrow's schedule and the next week's schedule. And I am also looking at last month's, last year, and forecast for this year, right? So when I'm going through my practices, and I don't know if my slides are going to be doing me justice here because they're not coordinating with what I'm talking. But anyway, when we are looking at, and I'll be more than happy to email anybody any slides that we have missed. So when I'm looking at a morning huddle, I am speaking to my team. I'm getting my team organized so they know exactly what is it that they need to produce by the end of the day. What is it that they need to collect by the end of the day? How are we going to get that new patient staying, accepting that treatment plan, and then referring family members? So, again, it comes down to a very robust team that you have or you have created in your dental practice, which is the team needs to know or needs to have a defined role that once the patient walks in, this patient is the most important thing in your dental practice, right? Because he or she is the revenue generator. He or she is going to be looking at and evaluating you, evaluating your practice, evaluating the care. Unfortunately, patients do not know what kind of clinicians we are. I mean, I could be the best clinician in the world, but no one knows, the distal of number 19, what a great margin I have on that distal, right? Because they're not clinicians. They know the only way you are going to be known as an amazing clinician is literally how you present yourself, how you are looking at yourself and looking at your staff and evaluating your office, right? Okay, so coming back to the morning huddle, we're talking about yesterday's schedule, what went wrong, the holes in yesterday's schedule, if there were patients that were sitting for too long in your waiting area, if there were issues with yesterday's schedule, if there was a crown that did not come in that the patient had walked in. So again, communication is going to be the key to running the dental practice. While I'm conducting the morning huddle for today, I'm looking at today's schedule. I'm reviewing numbers with my staff, okay? Now, key is the staff needs to know what kind of numbers are you looking to produce by the end of the day? What kind of numbers, what kind of collections, what kind of schedule, and what kind of production you're looking to get. So when you're reviewing those numbers, your staff needs to know that if Mrs. Smith is sitting in the recare section and she's getting her hygiene appointment today, Mrs. Smith needs to know, so the hygienist or the assistant who's working with Mrs. Smith on that hygiene schedule, she needs to know that Mrs. Smith had a crown on number 15 that Mrs. Smith had not accepted, or a treatment plan that was not accepted. Because again, you're looking at the whole in today's schedule and you realize that you're only producing X amount of production for today. So your hygienist or your assistant is going to take that crown patient or that patient who is sitting there in hygiene and talking to Mrs. Smith and saying, hey, Mrs. Smith, the filling on number 15, we had treatment planned it for a crown. It's started to fracture. Again, this is where key important information is going to come in play. Your software is telling you this was treatment planned 6 months ago. 6 months later, Mrs. Smith is sitting in your chair. She hasn't taken care of these issues. So she's now being educated by your staff that this filling has started to break. And in order for us to fix this, let's get a crown. Okay, so that is the reason why I really, really put a lot of significance into morning huddles. Not necessarily, again, I'll come back to the same thing. It's not about the morning huddle. It's about communication. It's about you recognizing that there is communication that exists from the front, communication that exists in the back, and the front and the back are communicating efficiently and effectively on a daily basis. Because as you start, as the day starts and the patients start to walk into your practice, there's very little time for a catch-up or a communication that is going to happen. Okay, so in the morning huddle, you're going to talk about numbers. You're going to talk about holes in your schedule. How are you going to fill those holes in the schedule with productive appointments? You're also reviewing from your software week to week how you have been doing. And again, you're also doing another meeting, which is going to be monthly meetings. Moving on to our next slide. What I feel is I usually give my staff certain tasks to do. So I expect my front desk to make at least 6 or 10 recall appointments per day. I also have certain lists called sooner than necessary available lists, right? So those are lists where patients who would like to get certain treatment done, yet your schedule is too busy. That is a list that you create for yourself, for your staff. The staff creates a list of patients who would like to come in sooner, but you do not have appointments for them. So there's going to be unscheduled treatment plan. Your software should have a list of patients who have come into your practice, not accepted the treatment plan, or have been lost in the system. So on a daily basis, your staff is calling recare patients, at least making 10 recare appointments, and 5 from unscheduled treatment plans. So how do we limit no-shows? What I like to do is I like my staff confirming appointments. What we like to do when we are confirming appointments, we like to confirm appointments 2 days prior to them coming. If your software allows emails or text messages, it's a great way of communication. A lot of patients who are tech savvy would like to get an email reminder from you saying, hey, Mrs. Smith, time for your appointment. We'd like to confirm your appointment, right? Now, what happens is when a patient no-shows. Now, what I like to do is we in our practice do charge for no-show rate. For a no-show appointment. Again, you could do a cancellation where there's a 24-hour cancellation notice. I do not consider that a no-show. I consider a person who is no-showing us if they were confirmed and they did not show up on the appointment. If they were confirmed and they did not show up for the appointment, you can allow this to happen one time. Now, again, this is a world where we have emergencies, we have kids, we have, numerous things that are happening in our daily life. So sometimes a patient has legitimate reasons, but if you start seeing, if your software has shown that this person has repeatedly no-showed you, sometimes again, the first time I never charge because you never know what circumstances a patient is going through. But if I see that this patient has no-showed us a number of times, there are 2 things I'm going to do. I'm going to get my front desk staff to never schedule that patient again. Because again, what's going to happen is that patient is going to no-show you again. Now, if that patient has emergency, what I tell my staff to do is if this patient calls us for an emergency, double book the patient. Because the chances that he's going to no-show again for this appointment are pretty high. And when you're confirming that person's appointment, you can actually let them know, hey, Mrs. Smith, you've no-showed us 3 times already. This is my prime chair time where I am spending my time with my patients. And the services that I provide, I have allotted that schedule for you. So I think it is wise for you. We are going to double book you for this appointment since you have no-showed us 3 times. So I think what I'm trying to point out here is you need to let your patients know that there is a value to your chair time. There is a value to the treatment you as a clinician are providing to the patient. So the patient needs to know that anytime they are having issues in regards to, no showing for the appointment, all they need to do is call and let us know, hey, I'm running late or I had an emergency. So if you stay in touch and you keep an open line of communication with your staff, what I see is there is, again, your no-show rate will decline. So let's go back to what today's dentistry looks like. Today's dentistry looks where you are more, you are doing your clinical side. You are going in, you are diagnosing, you are treatment planning. But really, what part of that treatment goes into the treatment plan acceptance is the key part of your dental practice, right? So you literally have to realize that the people in your practice, the treatment plan coordinator, she really has to spend the time in communicating with the patient, understanding, making the patient realize that these are the issues that are going to happen if you do not accept this treatment plan. So again, I go back to communication. I go back to, focusing on speaking to the patient, focusing on relating to the patient, and focusing about, how are you communicating with this patient so the patient realizes they are the most important thing in that dental practice. And if they don't take care of this specific issue, what's going to happen to them? The other part, and I've rushed through some treatment plan slides, but let me go back to a very important communication slide that I usually use. And again, these are slides that I repeatedly go through with my staff so they understand what is the importance of that patient. What I try to make my staff realize, the patient that walks in through your practice is going to be the most important person because he or she is a revenue generator for your practice. So again, when you are scheduling appointments, your staff should be very flexible. Your staff should allow. Now, what I like to do is, there is flexibility in schedules, but again, you're looking, and if you've had your morning huddles correctly, your staff knows that Tuesday morning, Dr. Khan has an issue with, filling that 9 to 12 schedule, right? So if everybody in the front desk knows that Dr. Khan comes in 9 to 12 is always a tough spot to fill, what you do is you get that patient in there and you try to schedule the spots on your schedule which are the hardest to fill. Okay, this is where again, you're communicating with your staff, you're talking to them, you've advised them that these are the blocks in the schedule, this is how you want the schedule to look, and this is how you want the production to be going. The other thing I do is my schedules are production based. I have column 1, which is chair 1, which is reserved for high production appointments. These are my crown. This is my bridge work. My column 2 is my recare chair. The recare chair should be booked every 10 to 15 minutes, where you are constantly seeing patients, you are constantly rotating patients, and you are constantly getting either new patients in or recare patients in through that chair. Again, I think we talked about keeping patient communication as far as pain management, talking about finances. The other part that really is something that sticks out is financial side of dentistry. Again, nothing is more important than you actually giving them the value of the dentistry that you are providing, value of the procedures that you are doing, and not translating it to the financial side of it. Let's talk about, again, this slide talks about objections to treatment plan. A lot of times when you come in and you tell Mrs. Smith, hey, you've got a crown on number 15, we're also going to do scaling and root planning, and Mrs. Smith sits there in the chair and she says, you know what, let me call my husband or let me think through this. That's where you are actually coming in, and you should have some kind of a financial policy for your office. In a financial policy, what I see, and this is how we do it at our practices, is we either have a credit card on file, or we have something where, if they prepay us for all this, for all the procedures, obviously they're going to get a 10% or a 15%. Or you break it down to like 3 or 4 easy payments. And then you make sure that Mrs. Smith is actually signing something at the end of her treatment plan, so she knows exactly after each treatment, after each appointment, how much she has to pay. Again, we're going through the daily things, that are important, holes in your schedules, hygiene schedule. What I've seen is if you focus on hygiene, hygiene is the most important determinator. I would say the best way to determine how your practice is doing is finding out how many of your patients actually transfer and translate into hygiene schedules. And what I consider a good hygiene practice management is at least getting 85 to 90% of the patients into your schedule as hygiene. Because really, what you're seeing is hygiene by itself is just generating X amount of dollars for you as a clinician on a daily basis. So, really, a very important part of your schedule is going to be having no patient walk out of your practice without a follow up appointment. I always tell my staff everybody walks out with 2 appointments. One is going to be the 6 months hygiene appointment, and one, if they need any kind of treatment, that's the second appointment they need to walk out of your practice with. Because really, this is determining the health of your dental practice. Finance, you need to know, again, it's just not you, but it's actually your staff needs to know what are the expenses of running a dental practice, and how are you going to capture those finances and really translate it into production and making your practice profitable. So again, like I said, production blocks are very important. Your staff is using a production tool. I don't know, certain softwares have production tools in the schedule, so you know how much you are producing per day. If there is a day where there's low production, your staff needs to know that that's the first spot, and that's the first appropriate thing that they need to do is fill that gap, fill that hole in the schedule. And that's where communication comes in. And that's where your staff comes in and knows that, hey, Dr. Khan is coming in today. We've lost the crown on the schedule. All of a sudden, an emergency appointment, calls for to get in that day. You're translating the emergency appointment and you're putting that into a root canal, core, and a crown. Okay, so that's where I'm saying production per hour is a key. It's not just you, because you know what you need to be at, but your staff need to know what they need to be there as an office. Again, financial policy, I touch base on financial policy a little bit, and that's just a waiver or some kind of a document that you have that, Mrs. Smith has come in, this is the treatment plan, this is her financial, breakdown, how we have broken down each appointment, and what is she responsible for. Practice dashboards, and again, I think I touched based on practice dashboards a little earlier on, is accounts receivable, number of new patients, production, collection, etc. Accounts receivable. I'm going to touch base just slightly into accounts receivable, because accounts receivable is telling you how much you produced last month and how much you collected last month. Now, if your production and your collections are not something that are at least 99% of production should be your collections, we have a problem. That means someone at the front desk is not collecting what they need to collect. So for us, since we're running several practices, what I like to see is at the end of the day, I use lots of these communication tools. I actually use WhatsApp. So all my offices are linked together through WhatsApp. And what they do is they come in and they share their production collection numbers with the entire team. Now, what does that do? Really, what it does is, if an office reach their goals, usually I have a lot of these office managers congratulating the other office, saying, "Hey, you know what? Shelley, you made your goal for the day. Congratulations, good job." So, what am I doing? I am instilling a behavior, a competition behavior between the practices, which, by the way, is a very healthy way for you to, motivate your staff, right? And I think I'm going to go through these slides in terms of motivation, etc. We've touched base on scheduling, you've touched base on production, you've touched base on hygiene, which are all important measures as we are evaluating your day. Marketing. What are you doing to get your office or to promote your offices? And again, it's always been a struggle. Marketing, there used to be, initially we used to spend a lot of money in, personalized marketing, where we would go in and share flyers, go or send coupons out to patients. What I've realized is that it's really a lot of money that you're wasting. It's also, a lot of people don't like getting that much mail. So a lot of people throw out half the mail. What I have been focusing on is really internet marketing, Google AdWords, Instagram, Facebook, Care to Share. And again, a lot of times we are putting live feeds on Instagram. We are putting, we have a large orthodontic, a large part of our practices is braces and orthodontics. So a lot of times moms are watching, moms in certain communities are watching what's going on. You throw a newsletter out, or you throw a coupon out on Facebook, or you go into these Facebook groups and you post something. I find this to be more effective marketing than me spending the money and sending out coupons. The other part of marketing that we try to do is something called Care to Share. So if Mrs. Smith comes in, she loves your dental practice. Honestly, there are two things you want Mrs. Smith to do: is go up on Google and review your dental practice. Because if you have a 4.5 or a 4.9 on Google, your practice is going to be showing up topmost when anybody is searching for a dentist in a specific area. The other thing I like to do is I like to do something called Care to Share, which is Mrs. Smith comes in, she loves your practice, she refers her child, she refers her husband. For every referral that she does for our practice, I end up giving them a $50 off or $100 off treatment value to that appointment that she has generated. So what it does is it creates that internal referral. And again, Mrs. Smith is going to go in, she's going to be talking to other people in the community saying that how wonderful you are. So she knows she's going to get X amount of dollars off for her treatment. I also do certain other things. If a patient has referred X amount of people to us, we'll give a free toothbrush. We'll give out a free electric toothbrush. We'll give out free T-shirts. We'll give out free pens. We'll give out mugs. We'll give out T-shirts. And a lot of times our T-shirts have our name, our phone number on them. So what is that T-shirt doing? That T-shirt is advertising your name as someone wears that T-shirt when they're going out. Okay, so that's how I find my marketing dollars or my marketing money to be well spent. Again, I also find free whitening to be an amazing tool for marketing. We don't use whitening as a service. We really use marketing as a referral to bring in new patients. I mean, everybody likes to have perfect teeth. Everybody likes to have white teeth. So what I do is, if I usually advertise, or I'll go into my website and I will put in free marketing for the first 100 patients. All right. Now, what is whitening doing is you're also, again, you're not going to whiten teeth that have decay. You're not going to whiten gums or whiten teeth that have gums that are bleeding. So, what is it generating? It's generating the new patient walking in, you diagnosing, you understanding that scaling and root planning is a good part of it. We need to complete all this treatment prior to us doing the whitening. So, as we hit our last slide, I'm going to talk about branding, and I think I touched base in earlier on, where recognize your brand, recognize your mission statement. Your staff needs to know what your mission statement is. You yourself need to know what your brand is, right? If you don't know, or if you are hesitant of what is the dentistry, what is the community, who are the community people that you are serving to, if you don't recognize your brand yourself, your staff is not going to understand what your mission statement is. And that's why I spend, honestly, a lot of time when I interview or I am bringing in new staff members joining our team. That staff member needs to realize, that staff member needs to know what your mission statement is, what you're standing for. I take a lot of pride in community service. I go out there, we go out there, we go in, we help children, or we help communities that are underserved. So for me, it is important to have dentistry or services provided to communities that are unfortunate, right? So I think recognizing that brand is also going to be an important way of you understanding how you yourself are going to grow as a dental office. Another couple of interesting things that we do is we have a conference call once a week. All our offices are linked together via Zoom. I've started to use Zoom recently since it's become the most important, the best communication way of running meetings. So what I do is, Tuesday at between 11 to 12 o'clock, I have all our offices link into Zoom, and we talk about what went wrong this week. What can we improve? How are things looking? What are we shaping in? Where are we going? Right? So comes down to one thing: communication. I have goals set up for the practices. I have daily goals, monthly goals. And again, the other side of dentistry that is going to be very important is understanding the services that you are providing. The more services that you provide, the better chances you have in expansion and really expanding your dental practice. So orthodontics is a great way of increasing revenue in a dental practice. Endodontics, having an endodontist come on board or someone who's comfortable in doing more root canals than you are is another way of expanding the services that you are providing. I have a couple of periodontists who rotate through our practices as well. So we're dropping implants. We're doing all on 4 cases. And also, last but not least, is pediatric dentistry. I think pediatric dentistry is one of those those procedures. A lot of dentists don't like to see kids. So if you're offering nitrous, if you're offering any kind of sedation, I think that's also a very great tool of increasing the revenues in your dental practice. I just hope this was informative enough. This is how I run my practices with a keen eye, really looking at the numbers that are happening in the practice, and again, communicating with my offices. I've found that communication is the best key. They need to know, I need to know how to run this practice, and they need to know who I am and what am I representing in dentistry. Thank you very much for joining in. Hope you guys have some amazing lectures. I know there are certain other amazing lectures that have been put put in for in the conference. If you need any questions, if you need to get my slide information, you guys can always email me. But good luck, and hope to see all of you live one day. Khudafis.